Hi, I'm Dr. Mark Carney. I'm a naturopathic doctor and an acupuncturist in Denver, Colorado at Thriveology. I have a family practice and I treat women, men, and children with acute and chronic conditions. I practice clinical nutrition, herbal medicine, homeopathy, acupuncture, and I support people through fasts, cleanses, and detoxification programs and weight loss programs. I treat many different conditions such as natural hormone balancing, supporting people who are going through cancer treatment, helping couples to conceive, and providing advanced laboratory testing. I'm trained in two different professions, naturopathic medicine and oriental medicine. In naturopathic medicine, I attended a 4-year naturopathic medical school in Arizona, and I also completed a family medicine residency in Portland, Oregon. For my oriental medicine training, I completed a 4-year Masters of Oriental Medicine program in New Mexico. Prior to all of this, I was trained as an emergency medical technician, and I was involved with a crisis line for several years. In the state of Colorado, I'm licensed as an acupuncturist and registered as a naturopathic doctor. While the history of Oriental medicine traces back thousands of years, the history of naturopathic medicine goes back to the late 1800s when a German medical doctor was frustrated with just using medication and surgical procedures and wanted to do more for his patients. And so he added in herbal medicines, homeopathy, and a wide array of other therapeutics, such as nutrition, to help his patients. Modern-day naturopathic doctors receive training that's very similar to what a medical doctor or a doctor of osteopathy have to go through. It's a 4-year medical program, and the curriculum is very similar, and the number of hours are very similar. Some of the differences are that naturopathic doctors are not trained, for the most part, in hospital-based medicine, and we're not trained to do surgical procedures. Also, naturopathic doctors do not use pharmaceutical medicine as the mainstay of their practice. Another difference is that naturopathic doctors receive extra training in nutrition, herbal medicine, homeopathy, mind-body medicine, physical medicine, and many other therapeutics. But it goes back to the philosophy of what makes my profession different. Rather than what we do, it's why we do what we do. The philosophy that I operate under is based on two assumptions, and I think they're both fair assumptions to make. Number one, we're supposed to be healthy, and the vast majority of us are indeed born healthy. Number two, we're supposed to be able to heal from just about anything because built into us is a self-healing mechanism. And so, I think the most important question to ask, but is often missed or ignored, is the question, why? In other words, if you come here and you have some kind of condition, I need to ask the question, why are you having this? Why is your self-healing mechanism not engaging? And the answer is usually one or both of the following. Either something is getting in the way of the body's ability to heal, or something is missing without which the natural ability to heal cannot work or operate properly. And I'll give you two real-life examples of each case. For the example where something is interfering with the body's ability to self-heal, I had a patient who had migraine headaches, and later we learned that her bedroom was above her garage, and in her garage she stored a lot of chemicals. And so the simple solution was either remove the chemicals from the garage or change the location of the bedroom, which is what she chose to do, and the migraines never came back. For the example where something is missing, without which the body can't heal, I have a patient who had chronic, severe depression and severe fatigue. And it turns out he had extremely low vitamin D levels. And so the solution was really simple. Give him high doses of vitamin D, which we did, and in less than a week, his fatigue and depression were almost completely resolved. We could also use my thumb as an example. If I got a paper cut, I don't have to tell my thumb what to do, and in fact, I like to joke, if I did tell my thumb what to do, it would slow down the healing process, not enhance it. But if my thumb didn't heal, and let's say 3, 4, 5 weeks went by and my thumb was still injured, I should ask the question, why? What's going on? And so either something is interfering with my body's ability to heal the cut, or something's missing. Maybe I don't have enough zinc, or maybe I don't have enough protein in my diet to heal this injury. I have 4 biases that I like to share with everybody up front. Number 1, I don't want you to be normal. That's right, I don't want you to be normal. I want you to be optimal. I want to enhance your health and make it the greatest, most impressive, glowing, radiant health possible. Number 2, I'm a minimalist. That means I'm going to recommend the lowest effective dose for the least amount of time with the least invasive procedure or therapeutic. My belief is, why take 6 bottles of something if you really only need 3 bottles? Or why take 3 capsules if 2 capsules is going to achieve the goal? Or why take 2 capsules if we don't need to take any capsules? Also, I'm a minimalist when it comes to the amount of time to see me, and I'm also a minimalist when it comes to the amount of tests. So if I'm going to recommend a test for you, then you know that it's something that I think is very important to do. Number 3, I'm a naturalist. And what that means is that I'm going to recommend the most naturally based therapeutics first. Don't get me wrong, I'm not opposed to medications and surgical procedures, and it's wonderful that we have them as options, but I think that they should be considered later options to consider. And the last bias that I have is I don't do cookie cutter anything. I customize and individualize my treatment plans to where you're at, and where you're at right now is not where you're always going to be at, and so the treatment plan needs to be dynamic and to evolve and change and adapt to what's happening over the course of time. I'd like to share with you what a new patient visit would look like so that you know what to expect. And a new patient visit with me is better described as an experience that has Part A and Part B. These occur over 2 different days. In Part A, which lasts about 90 minutes, the first half is me asking a bunch of questions about your medical history, and I'm using a fine-tooth comb to sift through any clues as I put on my medical Sherlock Holmes hat, because any one of those clues could help me solve the mystery. The second half of Part A, I do a physical exam where I check your vital signs, listen to your heart and lungs, and check your nervous system. We do some in-office tests that are appropriate. Everything is non-invasive. Basically, I feel like I need to be as thorough as possible in Part A, because if I miss anything in Part A, then I believe that I do you a disservice every time thereafter. In between Part A and Part B, I spend a minimum of an hour researching your case, and that's where I sift through all of the information that I gathered in Part A, plus any other information that's available through medical records, and I come up with a game plan. And there should be approximately 3 to 7 days in between Part A and Part B. When we meet for Part B, that lasts about an hour, and that's when I go through my recommendations of how I feel I could best help you. I will make recommendations of dietary changes, of any nutritional supplements that I think would be important, or herbal medicines, or any additional testing that I think is necessary. For new patients, we ask that you help the process go smoothly by doing the 4 following things. Number 1, my new patient paperwork is very lengthy and it catches people by surprise. It's not just a 1-page form that you can fill out in a few minutes. Many people take over an hour to fill this out. And so we ask that you fill this out before your visit and get it back to us before your visit, because I actually do read it and it helps me ask the most intelligent questions in our Part A visit. Number 2, if you're taking anything, whether it's prescription, over the counter, it could be an herbal remedy or a nutritional supplement, or otherwise, throw it all in a bag, or if you need to, throw it in a suitcase. I've even had people do this and wheel in suitcases, because I want to actually take the bottle, unscrew it, smell the product, read the labels, not just read a list of what you're taking. Number 3, we will be doing a urine test, so be prepared with something in your bladder when you come in, and don't just come right in and empty your bladder. And then number 4, if you have any medical records on hand, that's very helpful and speeds up the process. Otherwise, we can always have you sign a medical records release form, but that takes much longer than if you already have your own records. In conclusion, the good news is that there are many tools and many options that are available for how I can help you. But it's not about the tools that I use, it's more about the philosophy of why I'm using what I'm using. And that's where the art comes in, for me to customize and create a plan that's unique and specific to your needs. I take it as a very high honor to be part of your health process, and I realize you are trusting your health in my hands, and I don't take that lightly. Thank you for taking the time to listen to this, and I really do look forward to working with you soon.